Welcome aboard, everybody. Dr. Peter Glidden here. September 19th, 2013. It's the full harvest moon today of 2013. 5 more days left in summer this year. Can you believe it? 5 more days left in summer. Where does the time go? I certainly don't know. We had a great webinar last night. We had a great webinar this morning. 2 live chats back to back that you yourself could have access to if you were wise enough to become a subscriber, become a Dr. Glidden Insider. Check it out, fireyourmdnow.com. Click on the Become an Insider button and join the cause, why don't you? Knowledge is power. Elevate your gray cells, the gray matter in your brain. Get a clue. Healing is easy. Let me help to show you how, with over 100 hours of archived health recovery information available for point and click right now, and 4+ hours of live stuff every week, and that boy beats a poke in the eye with a sharp stick, don't you think? Last night on one of the chats there was an interesting question that I've been hemming and hawing about for for the last 12 hours more or less. So a woman had a question about her elderly husband who has all of these ailments, right? He was in his 70s and he had all of these ailments. And of course the MDs in their Machiavellian fashion had prescribed for him Coumadin, which is a blood thinner, which by the way is also rat poison. The more common name is warfarin. It's rat poison. They'd given this to him in order to thin his blood. And his wife, who was a devotee of longevity and among the living, heard our information about the stuff that we can do, the stuff that we advocate for people to support and promote the structure and function of their bodies, regardless of what the MDs say the problem is. But her husband hesitated to do it because of the vitamin K, and that his doctor said that the vitamin K in the nutritional supplements would interfere with the action of Coumadin. Vitamin K thins the blood, Coumadin thins the blood, and I thought to myself, well, let's think this through. Now, the MD knows that vitamin K thins the blood. That's why the MD said don't take vitamin K while you're taking Coumadin. So the MD also knows that vitamin E, like Edward, thins the blood, and the MD also knows that fish oil thins the blood, because every time you go for a surgical procedure, they tell you stop taking your vitamin E, stop taking any fish oil, and don't take any multivitamin supplement that has vitamin K in it. They already know this, which of course begs the question, if they know that essential nutrients, vitamin K, omega-3 and omega-6 found in fish oil, and vitamin E, like Edward, thin the blood, if they know that these things thin the blood, which they do, it's not debatable, it's an academic fact, then why don't they recommend their patients take these supplements instead of rat poison? If they're trying to thin the blood, if that's the goal, why isn't the therapeutic intervention the vitamin E, vitamin K, and fish oil, omega-3 and omega-6, where doses appropriate for body weight? Why don't they do that? Why instead do they prescribe dangerous rat poison loaded with side effects? Why do they do that and not give the natural stuff? Well, there's a number of reasons why they don't do that, and this is the disconnect that exists in the head of the MD, and I just don't understand this. Well, I understand why it happens, but I want lay people, those of you in the listening audience, to kind of think this through, because it uncovers the thought process that informs what MDs do, because what people do is informed by what they think, and what they think is informed by what they've been taught, especially if you're an academician. And anybody who has a doctor after their name is an academician. I mean, you have to do academics in order to get the doctoral degree, right? It's an academic degree. So the deal here is that MDs who don't practice medicine anymore, they gave up practicing medicine a long time ago. Basically now they're just salesmen for the pharmaceutical industry, right? They're not concerned with the pathogenesis of disease. They're not concerned with the causative factor of disease. All that they're concerned with is delivering whatever therapeutic is approved by federal regulations and that they were taught in school, and all that they're taught in school is drug and surgery, drug and surgery, drug and surgery. That's all that they're taught. So on the one hand, they know that the essential nutrients can thin the blood, but on the other hand, because they weren't taught anything about this in school, as far as, you know, what doses to take or this, that, or the other thing, they're less likely to do it because it's not really inside their scope of practice. Now, MDs can do whatever they want. That hasn't been proven, and they do this all of the time. They prescribe therapies that haven't been subjected to double-blind clinical analysis. They do it all the time. You know, they'll give a blood pressure medicine to help somebody sleep, or they'll give a heartburn medicine to help bring the blood pressure down, or whatever. It's called off-label prescribing. They do it all the time. But they'll never, ever do it with vitamins. They'll do it with drugs. They're more than happy to do off-label prescribing with drugs, but they won't do it with vitamins, and I don't know why they won't do it with vitamins, because they've been brainwashed, perhaps, to think that vitamins are second-rate, third-rate, fourth-rate, you know, secondary, tertiary, quaternary therapeutics, and that they don't stand muster to the big bad voodoo daddy of the pharmaceutical agent, number one, or number two, and number three. There ain't no money in the vitamin sales because you can't patent a naturally occurring substance. This is why MDs synthesized human estrogen. We're going to talk about that on my webinar tonight. It's how to balance female hormones. We're going to talk about that at 8 o'clock tonight Central Time. You can only view that webinar if you're an insider, but I digress. You see, you can't patent a naturally occurring substance. You can't go to Washington, D.C. and patent orange juice. You can't patent oxygen or vitamin C or vitamin E or vitamin K or omega-3 or omega-6 because they're naturally occurring substances. And nobody gets to exclusively produce them, right? Nobody gets the exclusive production rights for water, right? So because essential nutrients are non-patentable items, and because anybody can make it, there's no profit motive for the pharmaceutical industry. This is why they synthesize drugs. Now think about this, right? Most drugs come from plants, so why not just use the plant? Well, the reason is ka-ching. There ain't no ka-ching in the plant because the chemical that's in the plant is a naturally occurring substance and it's unpatentable. But if you do a chemical analysis of the plant, find out what the active biochemical constituent that you think is creating the biological or the physiological effect, then you can synthesize that chemical, stick a hydroxyl group onto it or stick a hydrogen atom onto it and change the natural structure of the molecule. And when you change the natural structure of the molecule, you have created something that no longer exists in nature. It's a man-made synthetic drug. That's where the term came from. Now, because it's never existed before on the face of the planet, because it was concocted in a laboratory, you can patent that. And if you can patent it, you're the only one that can make it. And if you're the only one that can make it, your profits soar until the patent runs out, and then it becomes a generic formula, and then anybody can make it, right? I think the average lifespan now for a patented medicine is 25 years, I think, but don't quote me on that. But the reason that MDs don't do vitamins is because there's no money in it. There's no bang in it. And the pharmaceutical reps are not telling them about this because the pharmaceutical reps aren't concerned with what's best for the patient. The pharmaceutical rep is concerned with the bottom line for the drug company that they work for. They don't care if there are side effects. I mean, if they cared about the side effects, they would have stopped giving rat poison a long time ago, and they would have given vitamin E, vitamin K, and omega-3 and 6 instead. But they don't. And, you know, I mean, it's an insidious little thing. And because they've monopolized the medical industry, they can do whatever the heck they want. And because they do it all of the time, and because it's such an overarching phenomenon here culturally, we just take it. We bend over and take it. Case in point, Premarin. Premarin, of course, and I'm going to talk about this at length, plus a lot of other concepts of hormone intervention on tonight's webinar, 8 o'clock. You got to be an insider to get it. Check out the website, fireyourmdnow.com. Click on the link to become an insider, and you'll have access to all of the information that we talk about in the webinars. into all of the archive stuff as well. But, you know, medical doctors a long time ago saw that women in the menopausal years were struggling, right? They're struggling with mood, they're struggling with osteoporosis, they're struggling with hot flushes. It was a rough, a tough row to hoe. And they knew it was a hormonal problem, but instead of saying, well, look, boys and girls, we know that this is a hormone problem, so let's just support the liver, or let's give the body nutrition that it needs in order to make hormones. Instead of doing that, they said, oh, no, here's what we're going to do. We're going to synthesize a hormone that's never existed before on the face of the earth. That's what we're going to do. We're going to make a man-made hormone. We're going to outsmart God. Because remember, you can't patent natural human hormones. You can make natural human hormones in a lab. You can make estradiol, estrone, estriol, which are the 3 types of estrogens. By the way, did you know that there's no such thing as estrogen? That estrogen is a collective term used to describe a number of different molecules. Did you know that? I'm going to teach you more about that on tonight's webinar. But I digress again. So the MD said, look, we're smarter than God. We know that this is a hormonal problem. So rather than giving women natural human hormones, bioidentical hormones, what we're going to do is we're going to create a hormone that never existed before. So they took 1 part human hormone and 2 parts horse hormone. Equilin and equilase, they mixed them together. Voila, you've got Premarin. That, by the way, is how Premarin got its name, because the horse hormones, equilin and equilase, are extracted from the urine of pregnant mares. And I'm the quack. Only 2 problems with Premarin: breast cancer, uterine cancer. Oops, there's a 3rd problem, thrombophlebitis. Thousands of women died, got cancer and died because of the MD idiocy and profiteering. And if you're not angry, you're not paying attention. We're going to talk about this and many more concepts of women's hormone health tonight on the webinar. Check it out, fireyourmdnow.com. Click on the Become an Insider button. I'll see you there. Stick around, taking your calls when we come back. Welcome back, everybody. Dr. Peter Glidden here, September 19th, 2013. Happy to have with us. It's Thursday. Must be Thursday because you know what that means. Who's in the house? The Commander, a.k.a. Mark Denning. Check him out on Facebook at Wellness Warriors. Wellness Warriors. That's W-A-R-R-I-O-R-Z, like zebra.
Z.
Z like zebra. Welcome back, Commander. How's it going today?
How are you, Dr. Glidden?
Fantastic. I'm loving. Finally, we got another day of sun here after some pretty heavy rainfall here in Chicago yesterday. I'm happy that the weather has broken a little bit.
Yeah, that was pretty impressive rain last night. I was in the city of Chicago in the ambulance, and I was looking for the my boat.
Have you ever gotten stuck? You know, weren't able to cross the street in the ambulance because of floodwaters? I mean, anything that severe in your career?
Oh, yeah. And it's been recent. I got called in to help with evacuations and stuff just within the last year or so, because it was just ridiculous, the amount of rain that fell. And we just keep seeing that every day where I'm at. But think about those people in Colorado. Holy shnikes.
Yeah, I know. That was a big bad voodoo daddy that happened in Colorado. I mean, that was a big bad voodoo daddy. And they're very uncharacteristic for that part of the world also. I don't want to get too doom and gloom here, but when I look around the world and I see the things that are happening with the climate, I start to wonder what the heck is going on. I think something's going on. What are your thoughts?
Yeah, I think so too. And, you know, in that respect, we need to be ready just about for anything. So, I mean, the things that we do now, we help people to just maximize their health, and that will help them deal with these stressors all that much more. What do you think about that?
Well, I think it's advice well taken. You know, in the final analysis, life is a great big bowl of stress. And there's stuff that you can do to guard yourself from the normal everyday today stressors that you're exposed to. And then if you get a big bad voodoo daddy stress, then it's much easier for your body to handle that if it's nutrified and strong. So you know what our recommendation is: 1 Healthy Start Pack 2.0 and 2 bottles of selenium per 100 pounds of body weight per month, plus eliminate the 10 bad foods. Hey, Commander, I tell you what, the phones are all lit up here, so let's do a little tag team help on the phone. Sound good?
All right, let's play it.
All right, stick around, brother. We're going to Anthony from Alabama first. First of all, folks, 866-582-9933. That's 866-582-9933 to talk to Dr. Glidden and the Commander live today, September 19th, 2013. Hello, Anthony. Thanks for the phone call. You are live.
Hey, Doc, gentlemen, how y'all doing today?
Very good, Anthony.
All right, Anthony.
What's happening in Alabama, man?
Man, I'm trying to get back to Atlanta, Georgia, man. I got to get out of Alabama. It's not my cup of tea, you know.
God? You can't wear the crimson, huh? You can't wear the crimson, Anthony? Is that what it is? No, I'm just kidding.
What did you say? What did you say?
Is it all about the tide down there, as they say?
Oh, well, you know, I'm not a football fan. You know, that was when I was younger, but now I'm all about making money and business, you know.
Okay.
Yeah.
How can we help you out? How can we help you today?
I've got a young man, early 20s, just had surgery on ACL, and works outside and cutting trees and whatnot. But I was telling him he needs to get some of our stuff in his system because he's always out in the heat every day.
Yeah.
And
absolutely.
And I said, let me give Dr. Glidden a call and see what we can do for that young man.
All right, Commander, your thoughts about this. What do you do to help someone who works outside in the South, in the United States, and who also has a torn meniscus in their knee? What do you think?
So he tore the meniscus? Did I hear he tore his ACL?
Tore the ACL, the acromion ligament, yeah.
Yeah, I tore that myself, so I could talk from first-hand experience. You got to eliminate those 10 bad foods. You know, folks down in Georgia and Alabama and Mississippi, they love to fry everything, right, Dr. Glidden?
That's right.
We got to throw that out the window, Anthony. And then we got to get rid of the gluten, get rid of the lunch meat, get rid of all those things, just all the bad foods. And you can get that list by signing up at Dr. Glidden's website. We'll talk about that in a little bit. But anybody that works outside just pours minerals out of their bodies, and that can weaken all the soft tissues, including the ligaments and the cartilage and stuff. So I think for people like that, the Healthy Body Athletic Pack 2.0, 1 per 100 pounds would be an awesome choice, because not only does it afford you the BTT, the OsteoFX Plus, the EFAs, and the glucose gel, but it also affords you the...
All right, stick around, folks. We're coming back. Welcome back, everybody. Dr. Peter Glidden here with you on the full moon, September 19th, 2013, kicking it with the Commander, a.k.a. Mark Denning, and we are talking to Anthony from Alabama. Hey, Anthony, are you still with us?
Yes, sir. I'm still here.
Okay, very good. So the Commander has a good point. When you're working down in the South, you sweat a lot, especially if you're an outdoorsman. You're doing anything outdoors. I don't care if it's just cutting grass. And when you sweat out minerals. Not just sodium and potassium. You sweat out a bunch of minerals, and you know what are your ligaments and tendons made from? Minerals. So the more you sweat, the weaker your ligaments and tendons get, and then you step off of the curb the wrong way and something snaps, and then the MDs are more than happy to go in there and stitch it all together, but the stitching it all together does not do anything at all to strengthen that part of the body. So the advice stands, and it's good advice. I would have him drink a Rebound FX during the day as he's working out, you know, inside a water bottle instead of the Gatorade or the 5-Hour Energy or this other nonsense that the kids drink. And the recommendation, what was the recommendation that you had, Commander, the Healthy Athletic Pack? What's the deal with that?
The Healthy Athletic Pack, that's where you get the 2.0, of course. You get the BTC 2.0, the OsteoFX Plus, you get the FA Plus, you get Glucogel, and you get Rebound FX.
Gotta love it. So that's a good program, Anthony. I would have put him on the Healthy Athletic Pack, one Healthy Athletic Pack per 100 pounds of body weight per month. And within 4 weeks, he should see a noticeable and measurable turnaround, not only in his the knee, right, the knee that had the surgery, but also his mood, his energy, his sleep, his appetite, because remember, this isn't a ligament fix. This is a whole body fix. Check it out, Anthony. That's what I would do for him. I appreciate the call. I appreciate your patience. Going from Alabama to Oklahoma next. Lynn is calling with a question about carpal tunnel. Hey, Lynn, thanks for the call. You are live.
Thank you for taking my call, Dr. Glidden. I have a friend that has severe carpal tunnel. He's a bodybuilder. He's 53, but it wakes him up at night multiple times. It's pretty severe.
Commander?
Wow. Yeah. Yeah, Lynn, how are you?
Oh, I'm doing great. Thank you, Mark. How are you doing?
I'm great. Yeah, you know, we were just talking about that ACL tear and the meniscal tear, and this is along the same lines. Again, this bodybuilder has just been probably pouring out sweat, not putting it back, and putting some rogue supplements in his, you know, and he doesn't really know what's in there. That's what's great about Doc Wallach's product, that we know what's in there, we know the source, we know where it comes from. So, you know, again, that BTT, the Healthy Athletic Pack 2.0, would be great for him. And I would probably add some selenium, 1 bottle per 50 pounds. And the Rebound FX would provide those extra minerals he needs to help with the pain of the carpal tunnel syndrome. And if you wanted to get either CM cap or CM cream, that would also benefit him in a great way. What do you think, Dr. G?
Yeah, it's a good prescription. Well, my understanding of the carpal tunnel is that the carpal tunnel is it's a little physiological, anatomical tunnel, so to speak. It's a little tract that the blood vessels and the nerves that go into your hand get into your hand through. That's how they get in there. They all come together. It's like a 5-lane highway coming down to 1 lane, and they go through this little canal, so to speak, in your wrist to get into the hand. And the body has set it up that way so you can have mobility in the wrist, so you can move your wrist around and your fingers not going to go numb, or the blood circulation isn't going to get cut off. It's a very smart anatomical structure, right? Now, the tunnel itself is made out of soft tissue. And soft tissue needs nutrients in order to stay healthy. When your body runs out of minerals, specifically a peculiar little mineral called molybdenum, which is this weird little trace mineral that nobody's ever heard of, when your body runs out of molybdenum, that little canal, the carpal tunnel that all these blood vessels and nerves and ligaments and tendons go through, gets dried out. And when it gets dried out, it's no longer flexible. And so the ligaments and tendons and nerves and all the stuff that goes through this little canal get irritated. It's the same kind of a thing that makes your foot get a blister, right? If you get a new pair of shoes and the shoe hasn't been broken in, every time you walk it rubs up against the side of the shoe, and then that gives you a blister. It's irritation. Well, when that little canal loses its fluidity, the stuff that's going through it just by moving your hand becomes irritated and inflamed, not because you have a carpal tunnel, not because you have a wrist, not because you have nerves, but because your body's run out of the nutrients that it needs to keep that part of your body lubricated. And there ain't no amount of surgery on God's green earth that's ever going to fix that. Surgery is an inferior fix for this because it does not get to the root cause. So the Commander's on the right track. What's necessary here, in addition to the 90 essential nutrients, is extra plant minerals, because it's the extra plant minerals that contain the molybdenum which is necessary here to support and promote the structure and function of the carpal tunnel canal, whatever you want to call it. So you can do that in two ways, right? This guy's a bodybuilder, so there's minerals in the Rebound FX, but it may be appropriate and beneficial and speed things up if for 2 months, in addition to the 90 Essential Nutrient Program, the Healthy Athletic Pack, he added a 1 bottle of the plant-derived minerals per 100 pounds of body weight for a couple of months, just to give him extra minerals that his body can use to support and promote the structure and function of that little carpal tunnel. That's a good program. And also, Lynn, let's not overlook the obvious, right?
Yeah.
He's a bodybuilder. He's a workout guy, guaranteed. The knuckleheads at the gym, or his trainer, or his nutritionist, or whoever he's spoken to. Maybe it was Dr. Oz. He listened to Dr. Oz on one of Dr. Oz's episodes. Told him that he needed to carbo load, and that was the best thing in the world for any type of an athlete. You got to load on those carbos to give your body slow-burning sugar. Well, if he's eating wheat, barley, rye, and oats, 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 it's only a matter of time until he dies, because those foods punch holes in the body's nutritional tank, disallow the nutrients, the small amount of nutrients that are in the food, from getting into the blood, and he must be gluten-free if this program is going to come to fruition and produce noticeable, measurable results in 90 days. So the Healthy Athletic Pack, extra plant minerals, go gluten-free, and you know, have him give us a call in 3 weeks with an update. Does that sound like a plan, Lynn from Oklahoma?
Absolutely. I'm sure, I know he's gluten-free, but I am going to get him on the supplement. I'm excited to see exactly how far he can come.
Okay, great. And also remember, as a resource here, right, it's best if we point, right, bring people to the expert, right? So it's free on my website. If you click on the radio tab, you have access to every radio show that I've done in the last 6 months, because we record them all and then we post them all. You can even do a keyword search. So you can send this guy to my website. He doesn't have to be a subscription holder. He doesn't have to be an insider. You can send him to the website when he gets home from work and have him listen to what we just told you. And that's right, how we're going to change the world. Thanks, Lynn. You're the greatest. Keep up the good work in the great state of Oklahoma. Where do you want to go next, Commander? How about California? Does that sound good?
California. Let's go there.
Yeah, let's go to California.
Let's go there.
Hello, Daniel from California. Thanks for calling. You are live.
Hi, thanks for taking my call, Dr. Gluten. I just wanted to call in because I figured out what was giving me loose stools, and I know it's the Caltati or the glucogel and the liquid osteofix, and I know I'm like taking it wrong because, you know, probably some absorption issue that I'm having, and I just want to know how to like take it so that it doesn't give me those loose stools.
Okay, so you were taking the supplements, and your experience of the supplements was that you got loose stools, and then you figured it out by a process of elimination that it was one of the white liquid calciums that doing it. Is that correct?
Yeah.
Okay. So, Commander, I'm going to let you take a swing at this. What do you think?
So how often were you taking the calcium, and when were you taking it, and how much?
Well, I was taking them with meals, and I think the glucogel, it was like four, but one before going to bed, and I think it was just too much because I was taking some of them at the same time, but during a meal, and I think too much, but I didn't know how else to take them or when or.
Well, how much do you weigh?
195, 196, around there.
You about 6 feet tall?
5'11".
Okay, pretty good. You know, one of the things that you do when you, and are you gluten free? Let me ask you that.
Yeah, I eliminated all the 10 bad foods.
Yeah, that's awesome. We'd love to hear that. So what's happening is perhaps, and you know, what happens sometimes is your body doesn't absorb everything right away And I know I had this problem with Cal-Toddy, and you said you were using the Cal-Toddy. Is that correct?
Yeah, that's correct.
Okay. Yeah, magnesium can do that. So what you probably need to do, Daniel, is you need to spread out the amount that you take over the day. Instead of one at night, maybe a half a tablespoon with lunch and then a half a tablespoon at night. And you can continue to take it with some food. The liquid glucogel, and you're using the liquid glucogel, how come?
I was taking that like it was 4 tablespoons twice a day with a meal.
All right, I would change that up and just take 2 tablespoons with each meal, or you could even go 1 tablespoon with each meal for a few days and let your body build up to it for about 3 days, and then add 1 tablespoon per each meal until you get to 6 to 8 tablespoons a day. And I think that would be better for you. Your body's just trying to dial it in and get used to it, and you're using up what you need, and your body's getting rid of rest for now, but your body's going to need more. As your body gets better from going gluten-free, you have more of those little finger-like villi in there that are going to say, thank you very much for bringing those nutrients, and they're going to get it into your bloodstream, and you're going to feel 100% better.
It's good advice, Commander, and here's the deal, Dave, in light of the time that we're running out of here, or Daniel. So if your body weight is 200 pounds, so the recommended daily dose for the calcium, whatever it is, whether it's the Beyond OsteoFX or the Cal-Toddy, is 2 ounces a day. So rather than doing 1 ounce twice a day, do a half an ounce 4 times a day, which is 1 tablespoon. Yep. So do 1 tablespoon in a little bit of orange juice or a little bit of water 4 times a day. If that dose gives you diarrhea, dial it back. Do a half of a tablespoon 8 times a day. You just keep dialing down the dosage and take it more frequently until you find a method of intensity that is healthy and good for your digestive tract. And over time, you'll be able to up the dose. That's how you want to do it. Thanks for the call. Stick around, folks. Coming back with more. Welcome back, everybody. Dr. Peter Glidden here with you. September 19th, 2013, celebrating the harvest moon of 2013. Check it out. The moon looks best and brightest right after sunrise, so we're right after sunset. The full moon rises when the sun sets. Did you know that? There's a little bit of astronomical lore. It's been my pleasure to have with us today the Commander, a.k.a. Mark Denning. Please check his Facebook page out, Wellness Warriors. Check it out. Hey, Commander, any parting shots you got for me today, buddy?
Yeah, we're hearing it. You know, it's like we see all these people that wore out their joints over the summertime. You know, their excessive sweating, things like that. Let's go into the fall. Let's recharge it. You know, make a good choice. It's like the 2 birds that were flying, and the one said, I haven't seen any windshield for a long time, and the other one said, well, I guess you'll have to hold it. And so make a good choice. Dial it in. It's always a pleasure to talk to you, Dr. Glidden. And let's do this again next week, buddy.
I'll look forward to it, Commander. Go get him. There he goes, ladies and gentlemen, the Commander Mark Denning. Check him out on Facebook at Wellness Warriors. Going to finish out the first hour here in the great state of Texas, talking to Melanie about stroke. Hey, Melanie, thanks for the phone call. You are live.
Hi, Dr. Glidden. How are you?
Fine, thanks. Thanks for calling. What part of Texas are you in?
Oh, Corpus Christi, Texas.
Corpus Christi. All right. That's on the coast, right?
Got a shot of that new moon yesterday. There was a full moon yesterday.
Yeah. Is that on the coast?
Nice. Yes.
Corpus Christi? Very nice.
Yes. About 15 minutes away from the beach myself.
All right. Very good. Lucky girl.
Really nice.
Yeah. Thanks.
Really nice.
Thanks for calling. How can I help?
My mom just had a stroke last night, and she had a series of symptoms before she had the initial stroke. Also, they diagnosed her with fibromyalgia rheumatica.
Yeah.
She had like slurred speech, weak limbs, and appendages, pain in her hands, feet. Just I saw a really big decline in her health. And as of late last night, I got a phone call from my sister saying that she had actually had a stroke.
Yeah, okay. Well, so I'll tell you what to do. I mean, there's two good things to talk about here. Number one, if she'd been under the care of a naturopathic physician, or if she'd been a longevity member, this wouldn't have happened, because Dr. Wallach sued the Food and Drug Administration a number of years ago to secure something called a qualified health claim, because there's so much evidence, so much clinical study, so many published research papers that are available that supports the notion that supplementing with essential fatty acids, fish oil supplements or plant oils, you can get them from either, virtually eliminates the risk of thrombotic stroke, deep vein thrombosis, pulmonary embolism, and coronary thrombosis, which means you ain't going to get a stroke. You get a stroke because your blood doesn't clot correctly, your blood clots incorrectly, and then there's a little clot in your blood where there shouldn't be. It breaks off, travels through the bloodstream, lodges in the brain, and then you get a stroke. So if the blood was healthy, it never would have clotted inappropriately in the first place, and you never would have gotten the stroke. And so one of the best preventive steps anybody can take in order to ward off the big bad voodoo daddy of a stroke is essential fatty acid supplementation. We have a certified health claim from the FDA that allows us to say this, number one. Number two, research published in the last year shows that people who have had a stroke and then supplement with selenium in therapeutic doses recover in half the time as people who don't do that. So your mom needs the Healthy Start Pack and selenium appropriate for body weight. The best way to do that, I think, is the Healthy Start 2.0. One Healthy Start 2.0 and 1 and 2 bottles of selenium per 100 pounds of body weight per month. I'm gonna take that back. It's not the healthy pack that she needs. It's the brain and heart pack, because that has more essential fatty acids which she needs. So it's 1 healthy brain and heart pack and 2 bottles of selenium per 50 pounds of body weight per month, plus eliminate the 10 bad foods, and watch her bounce back from this in record time. Thanks for the call, Melanie. Regretfully, we are all out of time in the first hour. Ladies and gentlemen, thanks for tuning in. Check out the live feed at fireyourmdnow.com. I'll see you at 6 after the hour for hour 2. Stick around. Welcome aboard, everybody. Dr. Peter Glidden here, steadfast advocate for health, welcoming you in the second hour, where we are experiencing, again, technical difficulties with the video feed. It's got to be Google Hangout. Will somebody please talk to the people at Google Hangout and get them to get their technology together, for goodness sake. We'll try to fix this out in the next break. In the meantime, you're just going to have to be happy listening to the voice. We're going to go to California and talk to Dave about birth control, of all things. Hey, Dave, thanks for calling. You are live.
Thank you, Dr. Glidden. Hey, I think a lot of people know that the papaya enzyme back about 1951 or 52 was discovered to be a birth control thing that eventually became the pill. Now, we have folks that are using Mexican yam for birth control. And I'm thinking of asking you about that. And I'm thinking about sending these girls that are using this after they've been on it 2 months over to Dr. K and see if they're ovulating in the 14th day of their far off am I?
Well, I don't have any experience with this. The wild Mexican yam was touted as a hormone balancing agent because it's high in phytoprogesterone, which is a plant-based hormone that's very close in molecular signature to human progesterone. But the yam, Latin name Dioscorea villosa, is, depending on where it's grown, what the soil's like, how it's harvested, how it's prepared, how the active ingredients in it are extracted. There are all these variables that go into making one bottle of over-the-counter yam extract high in phytoprogesterone, and the bottle right next to it on the shelf low in phytoprogesterone. See, this is the problem. Now, this is where the Germans come in. One of the things the Germans got right, in my opinion, is they have a very intimate relationship with botanical medicine. There's a part of the German pharmaceutical engine is called the German Commission E. Commission E, that's Commission with a K, E like Edward. And German Commission E regulates the manufacture, the sales, and the distribution of medicinal agents made from made from plants. And it may interest you to know that the largest selling medicine in the world is a German extract of it's of ginkgo biloba. It's a German extract, of hypericum. Hypericum as an antidepressant. It's a German extract of the herb Hypericum perfoliatum, which is used as an antidepressant. It's the largest selling medicine in the world, and it's made by the Germans. And they take this stuff into the lab, they grow it under controlled circumstances, they extract what they think are the active ingredients. They standardize those active ingredients so that every pill, every pressed tablet of the German herb medicine has more or less the same milligrams of the active ingredient that the next pill does. They're very, very, very good at that. Now, this, of course, is fractionated herbalism, because what they're doing is they're targeting one or two of the biochemicals in the herb instead of all of them. When we have a big argument, there's a big argument in the botanical medicine community as to which is better: the standardized extract of one or two of the chemicals in the plant, or just taking the whole plant, right? In it, with some type of an alcohol or oil extract or water extract. But I don't know if I'm answering the question appropriately. Is the only way that a yam or any other botanical medicine or food source could act in a way to change your natural human hormone levels would be if it was standardized to contain a certain amount of plant hormones in every single dose. And the over-the-counter yam creams are not. Now, if you could find a German extract of yam cream, and actually there was a company in Oregon called Bezwecken, Bezweckin, which was started by a naturopathic physician. They had a standardized extract of yam cream, and it was great. But I believe that just 2 months ago, the Food and Drug Administration ordered them to stop making it. So go figure. The only yam extracts that actually had certifiable amounts of phytohormones in them, phytoprogesterones, phytoestrogens in them, you can't get anymore. And the over-the-counter stuff just doesn't pass muster because it's not standardized to contain a specific amount in every dose. Does that make sense, Dave?
It does make some sense. Now, this is an oral medication, okay? An oral vitamin made by one of the common vitamin companies.
Yeah, but it doesn't matter whether it's an oral application, whether it's a vaginal application, whether it's a skin application. What matters is how much of the active ingredient that we're trying to use to push human biochemistry this way or that way is present. Is in it. Yeah. Yeah. And then we have the whole absorbability issue, right? I mean, is it in a gel cap? Is it in a pressed tablet? Is it does it have a shellac coating over it? Is it a cream? Is it in a vaginal cream? Is it in a, there's all these variables that then go into it after you've dialed in the amount of the active ingredient, and nobody's figured that out except the Germans. And honestly, the Germans are about 50 years ahead of everybody else in the world. But because the Germans are such reductionists about everything, their treatments don't do what they could. If the Germans hired me or Dr. Wallach, I mean, we'd change the world in about a year. We would. Because we're talking about holistic medical nutrition, which is quite a bit different than fractionated, and it makes all the difference in the world. But it's a point well taken, right? And you know, like I talked about in my little diatribe earlier, most drugs started in the plant kingdom. I mean, that's where they came from. Pharmaceutical industry has people swarming all around the Amazon right now, looking for the next plant. You know, and that's how curare, you know, there's a medicine, it eludes me right now, that they use for surgery as anesthesia, and it was derived from curare. Fascinating stuff going on in the field of, there's a name for it. There's a name for it, I'll think of it in a minute. But, you know, it's the field that's involved with looking at the chemical constituents of plants that you can use medicinally. It's fascinating.
Should we check the girl's ovulation on the 14th day at Dr. K's office to see if she's really different after taking the sham pill, so we could gain some knowledge?
Well, you could, but then the thing that you come up against is because the dosage isn't standardized.
Yeah.
You have no idea what's going to happen next month, right?
True.
You don't. So and this is a problem, and this is a big problem in the vitamin industry. I mean, even in the stuff, you know, like, for instance, a calcium supplement, okay? So let's say a vitamin manufacturer has a calcium supplement, and right there it says on the label 500 milligrams of calcium carbonate per capsule. They're not required by law to guarantee that there's 500 milligrams of calcium carbonate in that capsule. They're just not. And this is a big problem because most vitamin companies don't do the requisite testing, which allows them to faithfully say, yeah, the stuff in the capsule meets the label claim 100% of the time. They don't do that. So even in the wonderful world of, you know, vitamins that are dialed in to contain supposed to contain a particular milligram amount, there's no law that requires them to do that. And whether or not that happens is based entirely on the discretion and the integrity of the nutritional supplement company that's making it. It's a big problem in the vitamin industry, and I think the federal government should intervene in this regard, but they don't, or they don't enforce the regulations or enough, or the regulations that they put in place are ponderous, and the regulations aren't really established to protect the consumer. The regulations are established to bankrupt the vitamin company because the federal government is deeply in bed with the drug industry. And it's a big bad voodoo daddy. So, you know, there's a middle ground here somewhere. And the middle ground is science-based, clinically verified medical nutrition delivered through the application of nutritional supplements which have a really good track record made by a company that has integrity. And that's what Longevity brings to the table. Now, the whole thing of birth control enters into really gray area, because, you know, we're talking about forcing Mother Nature's hand. And I don't care if it's a bioidentical hormone or if it's a synthetic hormone. When you're taking something into the body which is trying to disrupt the normal hormonal rhythm of the human body, you are playing with fire. And even if it's a naturally occurring ingredient, you know, something's going to go haywire. This is why for birth control, condoms, cervical caps are hands down the best way to go. The combination of a condom and a cervical cap offers 100%, or I think 99.9% protection against becoming pregnant. That's a much better way to do it than messing around with the hormones in your body, either with a naturally occurring substance or with a man-made occurring substance. I don't know if that makes any sense, Dave.
It does make sense, and guess how this whole thing started? When the patch was discovered, they were using the patch. Talk about a powerful, you know, hormone drug going through the body where the patch absorbs it. Okay.
Yeah, so it's a little crazy, Dave. I appreciate the phone call. I appreciate your support. And I'm always happy to help. Keep up the good work. down there in California. We're up against a hard break, ladies and gentlemen. When we come back, we're going to go right to Houston and talk to Pat about skin issues, and then we're going to hustle off again to California and talk to Rod about something about surgery. I am Dr. Peter Glidden. This is September 19th live edition of Fire Your MD Now. Please check out the website of the same name, fireyourmdnow.com. Become a Dr. Glidden Insider and join us for tonight's webinar, How to Balance Your Hormones Naturally, a woman's health webinar. Very timely, I think. Dr. Peter Glidden, stick around. Welcome back, everybody. Dr. Peter Glidden here. We got the video feed up and running. Appreciate your patience with us. Appreciate your calling in. Appreciate your watching us on the live video feed. Check it out at fireyourmdnow.com. Going to go to Houston now and talk to Pat. Hey, Pat. Thanks for calling. You are live.
Hi, Dr. Glidden. Thanks so much. I want to say, first of all, I am gluten-free.
Good girl.
But I have something that's affected both sides of my nose, and it's the skin. It's really itchy. In the last few hours, it's starting to weep. When I put some colloidal silver on it, the tissue was yellow. You know, like the weeping was yellow. It's itching, weeping, and it's turning a little darker.
And it's on both sides of your nose?
Both sides of my nose.
That's interesting. Does it itchy?
Yes.
And has it ever happened before in your life?
No.
Has anything like this anywhere else on your skin ever happened, any of this in your life?
Yes.
Okay, where, if you don't mind sharing?
Like on my chest.
Yeah, okay.
On my chest.
What was it diagnosed as when that happened? Do you remember?
And it didn't. I've never really gone to any skin people. I just kind of tried to treat it, but on my face is a little bit more difficult.
Yeah, okay. So when we have recurring things like this, it's probably in the herpes family. It's probably a herpetic eruption, like a cold sore, you know, on your nose instead of in your nose. It's a very common skin ailment. Almost 100% of the population in the United States tests positive for the herpes simplex virus. It's everywhere all the time. And in some people it manifests and in some people it doesn't. Now, I'm not in the business of diagnosing stuff over the phone. I can't do that. Over the internet, I can't do that. But really, this all boils down to a simple solution, right? A simple sauce. What we're up against here is a skin condition. So what we want to do is support and promote the structure and function of the skin, and it's entirely possible because of the way that it's manifesting, that it's microbial in nature, infectious in nature. So the colloidal silver is the most excellent thing to do. I would go to CVS or Walgreens, get a little spray bottle, a little tiny spray bottle, put the colloidal silver in the spray bottle, and spray the heck out of it. Instead of trying just to put the drops on it, I would spray it. And I would spray it every hour. I'd spray both sides of the nose. And tonight when you go to bed, I'd soak a gauze pad with the colloidal silver. I'd tape it to your nose and go to sleep with it like that. I would. Now, internally, what you want to do is the killer biotic. Add the killer biotic into your program until this thing is gone. And what's your current body weight, Pat?
100.
All right.
And how much killer biotic?
6 a day. I would do 6 a day until it's gone.
Okay. Okay.
6 a day until it's gone. Now, one more thing that you can do is you can increase your consumption of protein because your immune system is made from protein. And you can also increase your intake of EFAs because your skin needs EFAs. Your skin needs EFAs. So
I take 9 a day.
9 of the EFAs? All right. So,
Yeah.
all right. Do you do any selenium?
And I take 2 bottles a month.
So that's 6 a day of the selenium, right?
Right. No, I'm more taking like 9.
Oh, that's even better. So you're good. There's nothing else to do here besides the killer biotic and spray the crap out of it with colloidal silver. Have you been under, like, any type of emotional or personal stress in the last couple of weeks?
Not really.
So it's kind of been life as normal. You haven't really done anything new, or you going to the gym now and you didn't before. You've started a new exercise routine or a new diet or anything like that?
Actually, I stopped and need to go back to exercising, but I have not been.
Yeah.
But I have not been exercising.
Yeah.
Would that have an effect on it?
Well,
emotional issues?
If it's what I think it is, then it happens because your immune system is depressed. And there's only a handful of things that can depress the immune system. One of them is, I mean, have you been overdoing it with sweets? Do you have a little bit of a sweet tooth and you've been eating more ice cream or more cookies or cakes?
Never touch the stuff.
Never touch the
stuff.
I
mean, I hardly ever use anything sweet.
Yeah.
And my bowels have been loose, so I've been trying to negotiate how to take all of my supplements without adding the loose stools to it.
Yeah, so you've got, it's the most probable thing to assume here is you've got a little infection going on in the body, a little immune system depression, a little herpetic outbreak. So I'm not going to get all worked up about it initially. Initially, what I want you to do is spray the crap out of it with colloidal silver, take the killer biotic, call me back in 7 days with a report, Pat. I'll be looking forward to it. Thanks for the call. Ladies and gentlemen, I'm Dr. Peter Glidden. This is Fire Your MD Now. Don't even think about touching that dial. Stick around. Welcome back, everybody. Dr. Peter Glidden here, your steadfast advocate for health, halfway through the second hour on the full moon of September 2013. Rod from California is up to bat with a question about surgery. Hey, Rod, thanks for calling. You are live.
Thanks for having me, Dr. Glidden. I have 2 quick questions, please. I'm dealing with people, my wife is from the Caribbean, and I'm dealing with people that don't have a lot of money, but they have a lot of blood pressure issues. Her father does and her brother does. What can I do to help them, for one? That's my first question.
All right. Well, the first thing to do is say, listen, I know a doctor that says you don't have to suffer with that. He's trained in medical nutrition, 20 years of clinical experience. If I send you a link to this webinar, will you watch it? And that's all you have to do. And then you email them a link to the webinar that I did about high blood pressure. They let the expert explain it to them. One of my strengths, if I do say so myself, is taking pretty complicated physiological concepts and dialing it down so anybody can understand it, because we've been duped by 100 years of cultural conditioning by the pharmaceutical companies to think that human anatomy and physiology is this complicated, complex thing, and it's not. It's easy. If you can pass a driver's license test, you can figure out what's causing high blood pressure and know what to do to get on the other side of it. So the best way to do, you got to get your foot in the door, you got to get people to listen, and honestly, if you hang out with me, become a Dr. Glidden Insider, hang out at Longevity, read a couple of the books, not even, just go to a couple of the websites, listen to the radio show, you're going to know what to do to support and promote the structure and function of, the blood pressure. But they're not going to listen to you, because who the heck are you, right? I mean, this is just human nature. So the very best way to be effective in getting people to try stuff is, rather than trying to become the expert, just take them to the expert. So, look, I know a doctor says you don't have to suffer with that. I'm going to send you a link to his webinar. Check it out, and then we can talk. Now, what to do, the first thing to do is we consider that it's a calcium issue. The first thing to consider is it's a low calcium issue. So the recommendation for first blush, circulatory system support would be 1, anti-aging, healthy start pack, 2 bottles of selenium, per 100 pounds of body weight per month, and 1 extra bottle of the liquid calcium a month, the Beyond OsteoFX. So that's the anti-aging healthy start pack and selenium appropriate for body weight, plus 1 extra bottle of the white liquid calcium a month. And usually within 8 weeks, the blood pressure numbers start noticeably dropping. Now, if the person goes gluten-free and cleans up their diet and follows our advice about what to eat and what not to eat, then it'll drop even faster and normalize even faster. I love helping people with high blood pressure to support and promote the structure and function of their circulatory system, because it's such an easy thing to measure, because they're taking their blood pressure a couple times any day, and son of a gun, the numbers are going to start to come down. It's that simple. And I got to tell you something, man. Once you help somebody get on the other side of a circulatory system thing like this, like blood pressure, you know, we don't talk about it very much. Maybe we should. But when you take prescription drugs into your body, it messes up how you think, and it messes up how you feel. It messes you up. But then, you know, you kind of get used to it. You know, it's like smoking cigarettes when you're a teenager. The first 3 packs, it's like you want to shoot yourself. But then you get used to it. Then you can't live without it, right?
That's right.
Yeah. So it's the same with prescription drugs. Being able to get people to safely and effectively stop taking their drugs, just from not having that crap in your body anymore, you know, all of a sudden it's like the clouds lift and they're normal again. So I'm telling you, man, it's a really rewarding thing to do, to get people so healthy that they don't need prescription medication for blood pressure. It's a beautiful thing to watch. And the secret sauce here is anti-aging healthy start pack and selenium for body weight, and then 1 extra bottle of the Beyond OsteoFX a month to start with.
Okay, thank you so much. Part 2 of my question is, this is a little more complicated, I think, because this guy, one of my friends, he had knee surgery, and they put a chip or something in his knee, and one of his legs is now shorter than the other.
Yeah.
And he walks with a limp now.
Yeah, go figure, right? Yeah, so thank you very much, surgeon. You know, that was a $12,000 deal. And, you know, I'm limping. And then what the heck? Now, with knee surgery, right, ostensibly that's because there's an arthritic problem in the knee. Well, why does somebody have arthritis in the knee? Because they have a knee? No. Because they have a titanium knee deficiency? No. Because they have a knee surgery deficiency? No. Because their knees have run out of the nutrition they need to maintain their structure and function. That's the only reason, unless, of course, you're run over by a tow truck or something. So surgery, even though it may provide relief, the relief is only temporary because the surgical procedure doesn't eliminate the root cause of the illness. The root cause of the illness is lack of nutrients in the body to keep the knee healthy. I've had patients, they've had 5, 6 fake knees. They get one fake knee, and 4 years later it fails. They get another one, and then another one, and then another one, and it's like the blind leading the blind. But this is what you can do when you monopolize the industry, and you can do whatever the heck you want. And even though your results are piss poor, you're the only show in town, so people have to keep coming to you. And this is why the MDs do not want me to be licensed in all 50 states. They're dead set against it. Because they know if we had a level playing field of medicine in the United States, if you had equal access, if there were just as many naturopathic doctors in your town, in your hospitals, if insurance paid for naturopathic medicine and we got half of the research money, within 5 years the MD general practitioners will be out of a job. They know it because their therapeutics don't work. And when you hold our therapeutics up to their therapeutics in the treatment of chronic disease, we win all the time. That's why they do not want you to know about me. That's why we have to develop a grassroots network like this. Because our stuff works and theirs doesn't. But most people don't know this because most people, you know, they're too busy with their lives to figure out the evolution of medical treatment in the United States and how it all happened, and it's nonsense. So this is a big deal, man. You can make a big difference in this person's life. The recommendation, right, it's not rocket science. It's a bone and a joint problem. So 1 healthy bone and joint pack per 100 pounds of body weight per month is a very, very, very good place for him to start. If he takes a healthy bone and joint pack and eliminates the 10 bad foods in 4 weeks, he will notice a difference somewhere in his body. And then within 3 months, 4 months, 5 months, 6 months, the knees, joints, everything's going to just turn right around, and he's going to feel like freaking Superman, man. Go out there and get him, Rod. You're the greatest. Keep up the good work. And, you know, listen, if people say no to you, which they do and they will and they're going to, just don't take, you know, develop a thick skin. Just look for the next person. Because, I mean, look at it this way. Nobody listened to Jesus Christ. They crucified him. Nobody listened to Noah, and guess what happened to all the people that didn't listen to Noah? They drowned to death. So the people that don't listen to you, they're going to get sicker and poorer and sicker and poorer and sicker and poorer, and then they're going to die. Meanwhile, you're going to get healthier and wealthier, healthier and wealthier, healthier and wealthier, and then you can buy up all their distressed property because you're going to be the richest man on the block, and you're going to be the healthiest man on the block. So, you know, don't lose heart, Rod. Keep up the good work. I'm very proud of what you're doing down there. Appreciate the call. Our good friend Abby from Miami is up next with a question about digestion. Hey, Abby, thanks for calling. You are live.
Hi, Dr. Glidden. Thank you again for taking my call. I'm trying to call as often as possible to provide little by little testimonials so people know. And today I wanna give you something new about my digestion improvement. I haven't told you. And I'm gonna put it this way: for the people that don't know, I suffer from chronic diarrhea for the last 20 years. I eliminated the diarrhea following Longevity protocol through you in like 6 to 7 months, 7, 8 months more or less. And I continued improving, right? Well, after I improved and I eliminated all the diarrhea and all that, I try to, the way I test my digestion is by concentrating the Beyond Tangerine. So when I started at the beginning last year in July, I could not take a scoop. I had to dilute it into like 25 ounces of water and get it very slowly. I spent the whole day drinking it, right? Well, right now, I'm taking 2 scoops in 8 to 10 ounces of water, and I don't feel it.
Wow.
Nothing happens to me.
How long do you take to drink that down? How long do you take to drink that down?
Not just one, just at once.
So you put 2 scoops in 8 ounces of water and you chug it right down all at once?
Right down with my meal.
Wow.
Yes. And nothing. I've been doing that for a few days. The last time I tried that, after 2 days, I started getting diarrhea again because it was irritating the inside. But I've been doing this for now like 3 or 4 days as a test to see how my digestion has improved, and I'm feeling perfect. You know, I'm taking basically like for a 300-pound person, I'm taking 3 times a day 2 scoops.
Yeah, you got to love it. And folks, if you're listening, watching the live video feed, I pulled up Abby's before and after picture. June 2011, 170 pounds. June 2013, 132 pounds. That's just the tip of the iceberg. He recovered from 30-plus chronic health conditions, 30-plus chronic health conditions in under a year, by giving his body the raw materials it needed to fix itself and by stopping the consumption of food that was gumming up the works. And Abby is a living, breathing, walking testimonial to the positive effects of science-based, clinically verified medical nutrition. If you want to get results like Abby, this isn't rocket science. All you have to do is get in touch with the Longevity representative. Get in touch with the person who told you about this radio show. If you heard about this radio show on the internet, then call us up, 855-347-3696, or go visit my website, fireyourmdnow.com, and click on the Longevity button. Join Team Glidden. Click on the Join Team Glidden button, and you will come into Longevity in my network like Abby did. And we'll hold your hand, and we'll tell you exactly what to do, when to do it, how to do it. It's very, very easy. There's no harm and no foul here. There's 2 ways to work with us. You can work with us as a customer. You can work with us as an associate, whatever floats your boat. If you're suffering from a vitamin M deficiency, you need a little more money, a couple of extra $100 a month, that's not a bad idea. Become an associate, become a business builder. We'll show you how to show this to your friends and family and church members and community members in a way that moves them into action. Abby, we have just a minute left. Any news about your radio show yet?
No, not yet. But I have a question, though.
Okay, go ahead.
I would like to increase my intake of calcium for a few months. And then I would like to ask you what would be the best way to do it. I'm taking the Health Star Pack too, but I would like to. I was thinking of getting capsules because they're easier to carry around, and I'm on the street or something like that. I want to have them with me, and I would like to ask you which one would be the best way to go.
All right, stick around, buddy. We're up against the hard break. I'll answer that question when we come back. Everybody, I'm Dr. Glidden. This is Fire Your MD Now. Stick around. Welcome back, everybody. Dr. Peter Glidden here. You're a steadfast advocate for health. We're closing it out today, the full moon of September 2013, September 19th, 2013. Talking to Abby from Miami, who has perhaps one of the best health recovery testimonials I've heard in a long time. Let me click on your button there, Abby. Welcome back. So the thing is, you want to do more calcium, but you're not sure how to do it. Well, the good news is that Youngevity's calcium supplements are unrivaled in the field of medical nutrition. The bad news is that it's my opinion that the capsules of calcium that Youngevity have stink, and they shouldn't even make them because they just don't work. Really, you only have three options for good, therapeutic, efficient, effective calcium dosing. The Beyond Osteo FX liquid, the Beyond Osteo FX powder, or the Cal Toddy liquid. Now, if powders float your boat, then what you need to do is you need to... I've heard rumblings that Youngevity is going to put the Beyond Tangy Tangerine 2.0 powder in those little on-the-go packs like they do with the Pollen Burst and the Rebound. But I don't know that they've rolled that out yet. You might want to go into the back office and see if they have that yet. I don't think they do. Notwithstanding that, in order for ease of use as you're out and about during the day, your only option is to put a couple of scoops of the Beyond Tangy into one of those really small Ziploc bags. And then when you're out and about and it's time for calcium dose, empty that into a bottle of water and shake the crap out of it and drink it down. The only other way is to use the liquids and put the liquids, in a little plastic water bottle container with whatever you dissolve the liquids with, and just put the appropriate doses in the car in liquid bottles, and then, you can just slug them down all day long. Those are the only two ways to do it. I am not a fan at all of the calcium supplements that are encapsulated anywhere in the world, including Youngevity. They're a waste of time and a waste of money because ounce for ounce, milligram for milligram, they just don't cut the mustard. And it's a crying shame that they haven't figured this one out, but they don't. What they should do, if it were me and I were, going to encourage them what to do next, I would have them take the Osteo FX powder and make it into a wafer, compress it into a wafer, so that you can just, add something to it to make it taste good, so that the wafer doesn't dissolve, melts in your mouth, not in your hand. So you can pop the wafers in your mouth and suck on them, kind of like the root beer belly, and then it dissolves and it's down the hatch and life is good, but they don't have that yet. So your only option is to the Beyond Osteo FX liquid, the Beyond Osteo FX powder, or the Cal Toddy liquid. I'm curious, why do you want to up the ante with your calcium? What's your thought process behind that?
Well, because and the reason I got into Youngevity is because I was looking for solutions to my herniated disc on my back. So what I'm trying to do is try to regenerate the disc. That's my goal. Regenerate the disc if I can completely to bring it back to normal. And I imagine that for that I'm going to need a lot of calcium and glucogel.
Yeah,
and I'm taking already a lot of glucogel.
Yeah, how much glucogel are you taking?
I'm taking 18 a day, and I'm 132 pounds.
Yeah, so that's a perfect dose. You can, I'd be okay with you doing more calcium. What might be a better strategy, though, would be 2 ounces of calcium a day and the plant-derived minerals as an add-on. Instead of extra calcium, do extra plant-derived minerals, and they make the extra plant-derived minerals in, a smaller. They make it in a capsule, right? So remember, when we're supporting and promoting the structure and function of the ligaments, tendons, bones, and joints, it's a holistic package. We need to give it everything that it needs on the outside as well as everything that it needs on the inside. And the superstructure of the cartilage that the heavy metals are attached to are sulfur-bearing molecules and plant minerals. So I think it might be a better strategy, Abby, to get a bottle of the plant-derived minerals and take 2 or 3 of those capsules every day. That certainly would be easier for you, and I think it would be more effective as well. Out of time, buddy. Thanks for the call. Appreciate you. Keep up the good work. Tonight, ladies and gentlemen, are you an insider? Desperate to balance your hormones? Have you tried everything with little results? Balance your female hormones naturally tonight. A live webinar for Dr. Glidden Insiders. Check it out. FireYourMDNow.com. God willing, back in the saddle tomorrow. See you then.